Clostridium difficile, affectionately known as C. diff. C. diff is a mild to severe diarrhea-causing bacteria that can inflame the colon, pseudomembranous colitis, and cause other intestinal conditions. It affects people on a global scale, but is most prominent within hospitals and long-term care facilities. Please click on pseudomembranous colitis to learn more. C. diff often results when a person's normal gut bacteria is altered, allowing C. diff to proliferate. Some long-term and high-dose antibiotics, along with gastric secretion pH-modifying medications, proton pump inhibitors, are among the culprits that allow C. diff to run riot. It is not C. diff in and of itself that is the problem, but the toxins it produces. They damage the bowel and cause the diarrhea. A person may have C. diff in their bowel but not be infected. They are colonized. There are many different strains of C. diff, but the North American pulse field type 1 is one that is more than likely to infect rather than to colonize. The image to your right is based on a photomicrographic data. This illustration depicts the ultrastructural morphology exhibited by a single gram-positive Clostridium difficile bacillus. Symptoms of C. diff. These include watery diarrhea, at least 3 loose bowel movements in 24 hours for more than 48 hours, fever, loss of appetite, nausea, vomiting, and abdominal pain, tenderness, and cramping. An increase in white blood cell count may also be seen. Dehydration due to the loss of fluids, weight loss, again due to the loss of fluid, and swollen abdomen. Complications resulting from C. diff include severe dehydration, loss of fluid and electrolytes. This can cause a drop in blood pressure and septic-like symptoms. Kidney failure. This can occur quickly due to the severe dehydration. Toxic megacolon. This is rare, but the colon is unable to expel gas and stool, causing distension, creating a megacolon. Bowel perforation. This results from the untreated megacolon, causing extensive damage to the intestinal lining. It can also result in peritonitis caused by the bacteria spilling into the abdominal cavity when the bowel perforates. Last but not least is death. Unfortunately, if C. diff is untreated, it can become fatal due to the complications, dehydration, kidney failure, bowel perforation, etc., etc. What are the risk factors for developing C. diff? What puts you at greater risk? A big one is hospitalization. C. diff is primarily a nosocomial type infection. However, it is not exclusive to hospitals and long-term care facilities. You can contract C. diff within the community. Those who are elderly and very young are at greater risk of developing C. diff because their immune systems are not as strong. Someone with severe underlying illness who is immunocompromised, cancer patients, chemotherapy, immunosuppressant users are also at greater risk because their immune systems are not able to fight the infection. Someone who's been using antibiotics and proton pump inhibitors like Prevacid and Penlock are of course at risk for developing C. diff as it alters your normal gut pH and flora. And again, someone who's had a previous C. diff infection, they are at greater risk for redeveloping another infection if exposed. For testing, stool testing, as you can see in the picture, we need some poop. And with that poop, you can do some enzyme immunoassays, pulmonary chain reactions, GDH, EIA, cell cytotoxicity assays. Please click on the link to learn more about these. Colonoscopy, it's not typically used, but a great tool for determining the damage within the intestinal wall. Abdominal x-rays, CAT scans for investigation of complications due to C. diff. Treatment, of course, with all that loose stool, you're going to become dehydrated. We want to rehydrate you. And we also want to provide you with good nutrition and also slow down that stool. So eating starchy foods such as potatoes, noodles, rice can help minimize the loose stool. Salting crackers, bananas, and soup can also do that, but they also help replenish those lost electrolytes. Oral probiotics aid in normal intestinal bacteria restoration, but they do not help fight the infection. Just want to make that clear. To fight the infection, you want your strong immune system, and if you don't have that, you want some good antibiotics such as flagyl and vancomycin and fidaxomicin. Fidaxomicin is quite expensive though. You want to take these antibiotics orally as opposed to intravenously so they affect the gut flora directly. Surgery for those complications, organ failure, toxic megacolon, peritonitis, and bowel perforation. A new one, FMT, fecal microbiota transplant. You're transplanting healthy stool into someone who has C. diff. Please click on the link to learn more about that fascinating yet gross new procedure. Now you've gotten this far, how do we prevent the spread of C. diff? Your biggest one, your hands. C. diff is spread by fecal oral route, so you want to make sure your hands are clean. Using soap and water is best. Alcohol-based hand rub does not destroy the spores. For the patient at home, make sure after your bathroom trips that you wash your hands thoroughly, at least 15 seconds. In hospital, there are going to be contact precautions, gowns, gloves to help minimize the spread of infection. You're also going to be cleaning the room with a chlorine bleach type product which will kill the spores. You want to clean all surfaces and any shared equipment with this. You also want to avoid unnecessary use of antibiotics. So reviewing those patients' drug list and antibiotic use and proton pump inhibitors, whatever you can get rid of to minimize the risk of C. diff. Communicability, RTW, the incubation period of C. diff is 5 to 10 days with a range of 1 to weeks following antibiotic treatment for developing associated or antibiotic-associated diarrhea, ADD. And I'm not talking attention deficit disorder here, I'm talking poop. Like I said, C. diff is spread by fecal oral route. Contaminated surfaces such as toilets, handles, sinks, any surface touched by contaminated hands of infected or colonized person. Healthy people not taking antibiotics are at very low risk of developing C. diff. That's why it's not as common to pick it up in the community. So when someone goes home with C. diff, there aren't really any additional precautions. You just want to be careful with cleaning and washing your hands thoroughly. Using soap and water for at least 15 seconds after the use of the toilet or touching any dirty surfaces before eating and preparing meals especially. Your clean home, all-purpose cleaner should be effective, but a bleach product would be more ideal. But again, you have to be careful of bleach that you're in a well-ventilated area. Don't want to be dying from the chlorine fumes. Regarding work restrictions, exposures, there are no restrictions. You just don't want to return to work until you've gone 48 to 72 hours symptom-free. So no diarrhea for at least 2 to 3 days is very important. And even after you have no symptoms, you still want to be really, really diligent with that hand washing before and after bathroom trips. And that concludes our presentation. I hope you enjoyed it. Just another reminder about the importance of hand washing. And if you click on the earth symbol on the one image, it'll take you to cdifffoundation.org, and you can learn more about Clostridium difficile and support groups that are available. Thank you very much. Bye.